All right, everyone, let's go ahead and get started. We'll be mindful of your time. If you'd like to introduce yourself in the chat, please do so. We will have time at the end for you to unmute yourself and give some updates or information that you'd like to share, resources, etc. So let's go ahead and get started. My name is Jo Glaviano. I'm with Aurora Health Alliance, and I'm the co-chair of the Senior Circle Group. And I want to introduce Shirley Propey. Shirley, go ahead and introduce yourself as our co-chair.
Hi, everybody. I'm Shirley with Audio Information Network. And as Jo said, I also co-chair the Senior Circle. I put information about Audio Information Network in the chat. So definitely reach out to me if you have any questions about what we do. Good to see everybody.
Great, thanks, Shirley. And we will go ahead and get started with our first speaker, Cindy. I see you there. You should be able to share your screen if you need to. And I'll go ahead and let you get started.
All righty. Okay. Let's see if I can share my screen. Hi, everybody. I haven't seen so many of you for so long. So happy to see you all. I love this group and I have not been able to attend. It has been a little crazy in the field. So nice to see you, Jo.
You too, Cindy. Thanks for being here.
Shirley and everybody. So my name is Cindy Koch. Let me make this full screen. And I have a company called Aging at 5280. And we are navigators, help people navigate the healthcare system and help them downsize and find communities to move into. And pretty much help them figure out if they can age in place or if they need to move. And I've been in this field for about 8 years now. I had a home health company before I started Aging at 5280. So today I've been asked to share with you what the Greater Denver Placement and Referral Alliance, what we've been doing and why we're here and why all this happened. So when I got into this field 8 years ago, I came from hospitality. And I was looking for associations to get involved with, because in hospitality, there's an association for caterers, for event planners, for everybody, you know, as a trade association, so that you can further the profession of the industry. Well, there was nothing. There was the Jarrett, I can't say your name, Pat, Jarrettology Association. They were in place, but they were like a bigger view of a trade association. But there was really nothing for home health. There was nothing really for placement agents for sure. And so I was searching for this for about 5 years. And then Chuck Bongiovanni, who started Care Patrol, which is a very national organization, and he started this out of Arizona. So they came to Denver and asked us if we wanted to start one here. And so we said yes. And so I was the first president. I'm now past president. Pam Silverberg is the president. We've been in existence for 3 years now and have done some amazing work as far as getting an industry and a professionalism around this industry. So I'm sure most of you know what placement agents are. If you don't, how placement agents work. We get paid from the community and we're a free service to the families. A lot of people, obviously no one in really the general public don't understand what placement agents are. The biggest person in this field is a Place for Mom, which is very predatory. And how they work is that they get, advertised in every market. They will have people go to their website. When you go to the website, you sign up and they hold your name for 2 years and you are their possession for 2 years, which means that if I take a client to say Harvard Square and a Place for Mom already has your name and they're in your computer, I would not have gotten paid. So we have changed that. We've gotten legislation passed this year to change that. So I'll show that to you in my presentation. The purpose of the trade association is, I need to move this, people. How do I move this sidebar here? There we go. Okay, so a purpose of the trade association is to create an organization, a business doing business in the same sector. We provide professional development and education. And we, as a group, we participate in public relations, lobbying, and political donations. We produce conferences and do charitable events. And we are a nonprofit governed by bylaws and a board of directors. So when I got into this industry and I was asking people about trade associations, no one really knew about it. This industry is very, it's full of a lot of people who retired and wanted a second job. So a lot of people never even knew about trade associations. So when we started this association, there's about 70 people in a room. And I asked how many people know what a trade association is, and 3 people raised their hands. So I really knew that we had a lot of work to do to professionalize this industry, because this industry used to be a very spray and pray is what I call it, is people would just get someone's name, spray it out to all these communities, and then want to check at the end and not do anything. You know, they wouldn't go for tours, they wouldn't do assessments, they wouldn't do so many things that you need to do to help families through this process. So that was a big challenge that I saw in this industry. So when no one knew about it, I said, well, I've done trade associations all my life. I'm an entrepreneur by trade. I've had many companies, and I've always been in associations because they're so important for best practices and all the things that we do. So that's the purposes of a trade association. Our mission is to have families have right to choose agents for a fair marketplace. We have created national best practices, national certification. We have a certification system now for credentialing for placement agents, which there was nothing in place at all when we first started this. We've now been testing for about 1.5 years. I've gotten my certification, and we wanted to build an industry with professionalism. So that is kind of what our mission was, and we have been able to meet that mission and those goals. So we have created best practices, which was a very trying exercise to do best practices when you're dealing with people who have never really owned their own businesses, and they didn't want to be told what to do, right? They didn't want to be, I don't want to do it that way. And I'm like, well, you don't need to do it that way. But if you want to be a member of this organization, you're going to have to do the best practices, and so as placement agents, there's 45 of us, 40 to 50 of us in the market. And we got together, and it was about 1.5 year process that took us to get the best practices in place. And so some of our best practices that we have created is that you have to meet with your client to perform a quality assessment. You have to tour with the families. That still is not happening in so many cities across the nation, that so many people do not go with their clients to tour the community, to ask the questions, to hold the people's hand. They just send them to the community and then expect to get a check. You have to be transparent to the families on how we get compensated. We did get some legislation passed on that. And agents have to carry $1 million of liability insurance. That was a huge sticking point of best practices. But when we are dealing with assisted livings, a lot of them don't carry liability insurance. So if we place somebody at a community, it would go first to their insurance, and then it could come back to a placement agent. And people didn't understand that. So we had to explain and teach people about what insurance meant. So as of today, all of our placement agents who are members have signed the best practices. So if you deal with any placement agents, these are the things that they should be doing as best practices. And so if you find that they aren't, we do have a grievance policy where you can call the president, who is Pam Silverberg, and you can make a grievance against a placement agent now. So, and then we take it to the national board, and then we assess it, and then we will talk to the agent. So that's a huge thing that we've gotten accomplished for building professionalism in this industry. Another thing that we've done is we've created a code of ethics. The GDPRA created a code of ethics for placements on how to conduct business and what code of ethics looks like, and we work within the industry with families, the senior living communities and community partners, and how not to take advantage of so many of our community, senior living communities. This industry just was kind of the wild, wild west out here 8 years ago when I started in this industry. But we've now kind of honed it in so that people do have parameters of what to work amongst. And I mean, like I've got a situation right now where I had a client call me and he called another agent. And so the other agent called me and said, hey, you know, I think we're working with the same client. And so we just said, hey, we'll just work on it together and we'll just split the commission. 3-4 years ago, there would have been a huge like dispute and a fight amongst these people, you know, agents, and they would have said, you know what, it's my client, you know, fighting over a client, and it's fighting over that money. And truly the client gets caught up in that middle of it. So that I've seen a lot of improvement in that arena in the last couple of years, that agents work with each other. They don't try to, you know, grab for the, you know, just for the bottom line. So that's been a huge win for us of what we've been doing. So we've gotten legislation passed. We got the disclosure law passed, which states that every client that we work with, we have to have them sign that we are compensated from the community, and that is where we get our monies from. Before, no one was even transparent with people. They would just say, this is a free service to the family. Families would say, well, how do you get paid? Oh, I get a referral fee. And it was very loosey-goosey. So now the disclosure law has been passed, and that has to be with every client. And the communities have to put that in the client's file and have it in the client's file for the whole time that they are living with them. This past year, we got the family choice law passed, which is it's your choice of who you want to work with as an agent. We are the only state in the United States that has gotten this law passed. They've tried in Arizona, Texas, California, and all of them have failed. And I think why we got it passed is because we were very unified on what this looked like. And it was a very simple law. And it was just, if your name is in someone's database and you don't know about it, you know, this is on online organizations, this is what they do, then you have a choice to say, you know what, I want to work with Cindy Cook with Aging at 5280. I don't want to work with this other company. I don't even know that I was in their database and I don't want to do that. So now the law says you can do that. So the regulation is that if that happens, then we send a letter to whoever they don't want to work with saying they are going to be working with this other agent. So that passed and that went into law September of 2020. So we're very proud of that. A couple of things that we're working on is the Medicaid reimbursement for assisted living right now. In assisted living, the reimbursement rate is $2,700 per person. In skilled nursing, it's $6,700 a person. And what we have found through a lot of research is that a lot of people go to skilled nursing because they need to go on Medicaid. Well, if they go to skilled nursing, then they are at the wrong care level and they really could be at assisted living, and they could be on a Medicaid waiver at assisted living, getting the right care, saving the state X amount of dollars, because that now we're caring for them at a different level than that they don't need to be at skilled. So many people go into skilled nursing not even having a skilled need. And that is, we're doing research on that right now. We've got a committee working on that to find out how many people truly are in skilled nursing that have no skilled need, but they're just there because of Medicaid. And so we're getting that data. We're working with HCPF on this, and that's what they've asked us to get for data. So we're working on that right now. Another thing we're working on is working with the state to help create a caregiver trajectory career plan. As you all know, we are very short-staffed. I mean, we are in a caregiver crisis in Colorado. And we need to come up with ideas of how to make caregiving a profession and how to make it, you know, more of a career for people. So we're working with a group from, I think from CHDP. I don't remember who the group is, but we're working with them to help create a trajectory career plan. Because the American Rescue Act that just came out after COVID, There's a lot, we got $500 billion for the state to work in the healthcare space. And money is going to the to this group that we're working with. And it's also going to HCBS services and all sorts of things. It hasn't been divvied up yet. I don't know all the specifics on that. I'm sure Pat knows more about that than I do right now. But so those are a few things that we're working on, but just being together as a cohesive group, it's been great to be able to get things done for the professionalism of this industry. So these are all the bills that we got passed. And that's it. Does anyone have any questions?
Cindy, I do have a question for you. And this isn't coming from me personally. I've just heard it from friends who are like, they don't really understand the whole placement thing, right? Like they don't understand why is it a good thing to have these people, et cetera, et cetera. But one of the concerns that these folks have brought up is that they understand that typically a placement agent is paid by the facility, right? Not the client.
Right.
And their concern is, well, does that mean that places that aren't going to reimburse these people are kind of left out of the mix? And is that bad for my person? You get what I'm saying?
So there's not many places that do not reimburse placement agents.
Okay.
Rest and the V and is pretty much the only, and those places, I mean, I've never recommended anyone to, those are way too big of campuses for people who are at the level that we deal with. That's
Okay.
for independent people and they can go on, you know, they're on their own. Yeah, no, I was just talking to Ed Wagner about this yesterday. It's just like, you know, families think that we exclude communities because we don't get paid from them. Well, you know, I would never do that anyways, but there are people who do that. But we get paid by all the communities. Some of them will be a lower percentage. So I think people, you know, may sway them to different places. You know, I have heard that people will, oh yeah, well, they're paying more, so I'm going to go there. Well, is that really the right fit for the family? So you know, I'm like, I do Medicaid too. I help people get onto Medicaid and I help them spend down and figure out how they can qualify for Medicaid. So like just going through that process with the client, like I've got a client right now who it's a couple. He needs independent living and she needs skilled, right? So this is such a challenge when you're trying to do this, and they've moved 4 times in the last 7 months doing this on their own. So like someone referred them to me and said, you know, these people need help. They've moved 4 times. And just, you know, talking to this couple, it's just like, that is such a hard combination when someone's very independent and then someone needs really skilled. So you need to understand what the communities are, what kind of support systems to put around them. And that's when I think truly when we do the best work is when there's real difficult cases and really help them figure out and navigate what that will look like for them.
Gotcha.
You know,
thanks so much. Yeah.
Yeah. So it's just, and you know, like another, you know, like we'll get cases where it's just like, they're like, well, the dad needs to go on Medicaid and the mom is fine, you know, and so how to navigate that whole system when there's a couple and how to get them situated so that they don't lose their nest egg keep trying to care for the person who needs higher acuity care. So I think the more I just went through this process, I just moved my mom to Kaylee Ridge because my mom needs to go on Medicaid. And it was hard for me to do it by myself, you know, and so I engaged one of my agents to help me, and really just them talking me down the ledge on things that I say to clients all the time. You know, don't take it personally if they're mad. Don't take it personally that they are upset with you, you know, and things that I was taking, you know, to heart that I always tell clients all the time not to do. So I personally now totally understand it.
Right. And I really appreciate you saying that, because I think a lot of times what I see in our industry is, you know, like we think we know things, and we do, right? It's not that we're not knowledgeable. When you add that this is my personal connection, when you add that to the mix, knowledge can go out the window because it
Oh,
becomes emotional, right? It becomes personal, and that's hard.
I mean, I guess, I'm not a real emotional person. So I always say to people, I'm very compassionate and but I'm not really, really emotional and empathetic, I guess. But after going through this myself, I'm thinking, my God, for people who are truly empaths and very emotional, this is such a huge strain on family units to have to figure out this navigation of healthcare. Another thing I want to share with you all that, this is one of why I wanted there to be a professional organization, is because healthcare is a business. Healthcare is not looked at like a business. People in the industry are truly or clinically trained, but not organizationally trained. They don't, I mean, that's why I think we have such huge turnover in this industry, because we have people running organizations from a clinical perspective, and they are getting demands to get a bottom line. Well, they've never really gone through a business school, like I've got a master's in organization management. They've gone and gotten an RN or have gotten a social worker degree that really doesn't ever deal with business. And healthcare is a business. And it makes me so sad that healthcare has a dollar amount on it, but it does. So if it is a business, we should run it as a business so that we can keep staff, we can keep organizations running, and not burn people out.
And pay people what they're worth.
Yeah. And besides COVID, I mean, put that aside. I mean, I saw this, 2 or 3, I've seen it ever since I've come into this industry. I'm just like, we've got people running organizations that do not even have soft skills on how to run a business.
Hey,
and so
Cindy,
that's, yeah.
Sorry to cut in. I just want to get to another question. I see Carol has her hand up, so I wanted to.
Oh, thank you. Thanks, Joe.
Sure.
Yeah, Cindy, you started with and mentioned, and I just want to know, because I started to write it down and have a blank there, and I may have missed it, but I was with you all along. You mentioned the legislation to change the IE situation with a place for mom and harboring those names for 2 years. What has it been reduced down to? Are you getting that? I don't know if you're.
So they still can keep people's names for 2 years. We didn't go into their business structure. We just created legislation that the family has choice. So if my client says, I want to work with Cindy Koch, then I can send a letter to Place for Mom and say, you are no longer representing this family.
Okay, so it's the choice of the family to relinquish that other agreement they had with a Place for
Right.
Mom, or any other organization. Okay.
And of course, most of the time they don't even know that they're signed up with the Place for Mom. The only way that they know is that they all of a sudden get all these phone calls from all these communities, and then all of a sudden they get all this literature out in their mail, and I go to people's homes and there's just stacks of literature, collateral from different communities in front of them. I said, did you call an online or no, I don't. I went online. I said,
Right.
yeah, you got into some place that's an online and they're like, everyone's calling me. I'm so sick of it. I'm like, I know, I understand.
Sounds like our business. Okay, thank you.
Yeah. So that's why it is really predatory, because they're already dealing with someone who's already overwhelmed, and now they're getting even more overwhelmed.
Yeah.
Gotcha. Okay, thank you for that.
Sure.
Thanks, Cindy. Any other questions? If so, we can also put them in the chat too. I think Cindy, if you put your contact information in there, that'd be great. Thank you so much for that information. That's really helpful. It's great to see. And just kind of a shout out. I used a placement agency for my in-laws, and actually someone who's on the board there. So it was just really comforting to know that it was someone who knows what they're doing and was really helpful. And I mean, I don't know how we would have done it without that help. So it really is, it's a stressful time. It's a big decision. You're making decisions about someone else's health, really. So really having that person to help advocate for you and say, look, here are the top places I recommend. I mean, it was just really, I don't know how we would have done it without that guidance.
Yeah, we now are in the next year of where we have to now promote and educate the public of what we do, because we're very unknown
Yeah.
as an industry. So, but thank you for that testament. And all the other things that you have to do is like downsize and all the different things that you have to think about, and their health care, right? I mean, all their prescriptions, just there's so many things that families have to deal with when you're moving somebody.
Awesome. Well, thank you so much. And if you're willing to share the slides with us, if we can send them out with our follow-up email, that'd be great.
You bet.
Right.
Thank you.
Awesome. Thank you so much. All right. We're now going to shift gears a little bit to Jarrett Hughes. Jarrett, you should be able to share your screen if you'd like. And thanks for being here.
For the invitation, and Shirley, thanks for reaching out ahead of time to coordinate this. So I put a couple of links in the chat, actually based on what Cindy was talking about. So I put a link to the Department of Healthcare Policy and Financing's general site that kind of captures information around the American Rescue Plan Act. And I also put a link that will take you specifically to the spending plan that has been submitted to the Centers for Medicare and Medicaid. So we have gotten a partial approval on our current CMS plan. Pretty much no state yet has actually received a full approval, as at least last I heard from the department. So relatively close to having that finalized, but Cindy's very much right that, really one of the focuses of that is to make significant investments in our direct care workforce. And then also, I think to that piece that Cindy mentioned around kind of tiered rates for assisted living to avoid that kind of misplacement in higher acuity skilled nursing settings for assisted living folks is a component of that as well. So a lot of work to be done on that front that we all know of. And it's, well, not getting too far off topic, it's great to see momentum around it, but it's very sad that it's taken the crisis that we're currently in to really kind of push that to the forefront of folks' agendas and priority lists, but we know that's often how it goes. I'm going to put another link in the chat right now, and that will take you to a Google form mail list. If you want to sign up, I send out information every so often, not on too much of a predictable cadence, and I don't flood folks' inboxes. So feel free to sign up if you'd like to get kind of information around legislative session or events that we're hosting, or just spreading the word around. As Joe indicated, I'm with the governor's office, and I am the senior policy advisor focusing on aging and older adults. I usually try to take the time to share a little bit about my background, because I think folks often say, hey, for someone in their mid-30s to be kind of primarily focused on aging in later life, I think often warrants some explanation. So, I really kind of arrived through this work through kind of my own family's experiences with caregiving and dementia, and spent a good deal of time growing up in and out of memory care and skilled nursing settings. And so in undergrad and graduate school, I really kind of focused on policy with a very specific demographic lens on that. So kind of led me to this world of gerontology. I got my master's up at University of Northern Colorado in 2018. So this position I am in, well, actually, first and foremost, I like to just kind of start with this quote from our Office of State Planning and Budgeting, just really indicating the gravity of our state's shifting demographics on the state in its entirety. So we all know this is nothing new to folks, but I do like to kind of start off with some demographics, and just so you all have these slides. I know I like to kind of pick and choose and kind of pull things out of other people's presentations from time to time. So I just wanted to share this. We see this significant growth from 2020 to 2025 in our population of adults 65 plus. More specifically to Arapahoe County, we see that trend pretty much mirrored, but a little more significant for folks 65 to 74. The other demographic piece that I like to show is this kind of demographic switch. It's kind of how I just refer to it, but the state as a whole is really approaching this first switch from having more adults over the age of 60 than Coloradans under age 18. Some counties have already made this switch. For example, if you were looking at our resort communities or some of our more rural communities, this switch has already happened. But in more of our metro areas, this change is kind of coming around 2023 is really kind of, at least for the state when we see it. And then in Arapahoe County, it's really kind of the time between 2025 and 2030 that we will see more adults over age 60 than Coloradans under age 18. I think the other piece that I always like to mention here is, while this first wave of demographic shift is our baby boomer generation, we have an equally large, actually larger population of millennials in the state. And so this is not necessarily a one-time deal. This is our new normal of demographic composition. And I think that's an important point to kind of not only drive home to policymakers at the state level, at the local level, but also organizations and the private sector, because as Cindy indicated, they have an important role to play in this process. So my job, my work is really to kind of lead policy development and agency implementation through this evidence-based demographic lens, and really focus on wellness across the lifespan, addressing health disparities, supporting workforce development, and ultimately reducing healthcare costs and supporting aging in the community or wherever older adults would like to be, really creating that opportunity for choice. So prior to joining the governor's office, I actually worked for the Strategic Action Planning Group on Aging. So I was their project administrator for about 3 years. This is a group that was created by the state legislature in 2015, a bill that our current Lieutenant Governor Diane Primavera ran at the time. So my responsibility, my job is to really take a lot of that work that we did through the planning group and find the logical integration points and the touch points in state government, but also community-based organizations. So, I primarily coordinate across state agencies. So I do a lot of work with CDOT, the Department of Local Affairs, Public Health and Environment, Human Services, HCPUF, which is our state Medicaid agency, which we've talked about a little bit already, and labor and employment. But it doesn't stop there because, aging in and of itself is just a lens that impacts all of our state agencies. And that quote at the very beginning from our Office of State Planning and Budgeting, they actually call it transportation and natural resources. So transportation's a little more obvious, but natural resources is a little more kind of opaque on how that relationship is really kind of where it is, I guess, where that intersection exists. And I think that the budget office did that at the time to really indicate the reality that it does cut across the state and doesn't only live in human services or Medicaid or public health. You all know this kind of being a part of this group in Aurora Health Alliance, but we have so many great community-based organizations in the state that are involved in this work, and nothing that we do at the state level would be possible without what happens at the community level. And that is where, that is really the last mile of implementation and service delivery and program development. And so it really is, from my perspective, our ability to kind of coordinate and bundle all these efforts together that generate sustainability and ultimately progress on moving the needle in this work. So one of the things that Shirley had, Shirley, I think you had indicated this, but I think it's in one of my earlier emails, was wanting to give a little bit of information on some of the epidemiology from our public health department around COVID. So I put some information in here. I'm not going to belabor it too much, but wanted to share this, the next few slides. So this is a 7-day incidence per 100,000 by county. You'll see that most of the state is in this 100 to 300 cases per 100,000 at the moment. And I guess I'll back up for just a second. All this data is relevant as of September 2nd is actually when it was all pulled. So haven't gotten anything updated this week, but this is the most recent. So sharing this, it's really good. We don't see too many states in this orange or none in the red, which is great. So, we are faring better than some other states around the country at this moment. The next couple slides, I think, are a little more illustrative as to what is actually kind of going on and what things look like. So we are moving up in case averages. That is a fact at the moment. We are still nowhere near our peak of last Thanksgiving, Christmas, but we are seeing an increase overall. This captures hospitalizations from confirmed COVID-19 cases. So again, we see a pretty significant peak here coming out of July through August into September. Again, we are still well below half of where we ended up in Thanksgiving, Christmas of last year. But this is not a trend that we hope continues for too much longer. But with that said, we are still, the hospitalization piece is, I think, one of the most important, because if our hospitals reach capacity or even get close to reaching capacity, that is when we really will kind of move more towards kind of some of those extraordinary measures that we've seen over the last year and a half. I think this is a great slide too. At least I think it promotes some of the vaccine confidence pieces. You'll notice the y-axis here, the vertical axis, the numbers are different. So these are rates per 1 million. So that's important to keep in mind. So for ages 12 to 17, you still see relatively low, 18 to 64, a little bit higher, but we still do see that 65 plus age range as being the most correlated to hospital admission. And you do see the significance of the impact that the vaccines have been having up until this point. All right, so shifting out of that kind of back into work priorities. So the real kind of major vehicle that we have to advance aging-related work in the state right now is Lifelong Colorado. This is really an initiative that began towards the end of Governor Hickenlooper's administration. And, I will be the first to admit that it has been a bumpy road. We have not had everything, we've not had the resources or the staff, we've had a pandemic in the midst of it all. So, I've been in the office for about 9.5 months at this point. And so really kind of my priority coming in was to kind of pick up Lifelong Colorado, re-energize it, and kind of put it back, just get it back in front of people and start talking about it more. So Lifelong Colorado really began as a focus on age-friendly livable community efforts, very similar to really kind of in line with the AARP network of age-friendly states and communities, but also what the Denver Regional Council of Governments does through their Boomer Bond work with community comprehensive planning in municipalities and counties in the Dr. Cog region. So while Lifelong really began as a livable community focus, as the state has become, we are one of, I believe, 7 states in the country, actually it might be 9 at this point, that are considered by AARP to be involved in this age-friendly work. And we are part of the age-friendly network of states and communities. But because of that, Lifelong Colorado really captures state, regional, and local strategies that support aging in the community. And it has a very clear health equity, health disparity focus with the intent on kind of bringing all the efforts together that we do at the state level and at the local level and trying to bundle them together. So I've got these next 2 slides, I think illustrate that relatively well. That's kind of what I was trying to say at least, but Lifelong Colorado is really this umbrella that captures state planning and local and regional planning. I think that one of the things that I often hear and have often thought about when I look to the Department of Human Services or the Department of Labor and Employment or the Department of Public Health and Environment, I see all of these different planning efforts going on. And I ask myself, and I get asked all the time, are they talking to each other? Where are these touch points? How do they overlap? So Lifelong Colorado is really that entity, and it is part of my responsibility to make sure that all of these pieces are talking to one another. So for example, talking about workforce development, the Department of Healthcare Policy and Financing is planning on doing all of this work and making these investments in direct care workforce. But I also know that Department of Higher Education is looking to make investments in demand, relatively, medium to high wage earning positions. If you look at top job postings in the state, it's CNAs and CDL truck drivers. Those are pretty much the two biggest ones. But if you talk to a transportation provider, and I actually was talking to some providers in the southwest part of the state a couple of weeks ago, they need CDL drivers. They also need direct care workers. So it's like, how do we kind of connect all those dots into this broader planning process? So Lifelong is really our vehicle to do that. And then I kind of have a second iteration of this image, and it is really, these are, whoops. Sorry for that. These are really kind of my very general work efforts, work priorities for the upcoming year. So I could spend, 45 minutes just talking about these 6 things, but we certainly don't have the time for that. So, really kind of supporting and building out the organizational structure of Lifelong Colorado is really kind of my #1 priority. And then all of these agency priorities we have. So HICPUF and the direct care workforce efforts. There's a lot of digital equity and inclusion work going on at the Department of Labor right now through their Office of Future of Work. And as part of the infrastructure bill making its way through Congress, there is a digital equity bill wrapped into that. And, I've really kind of started to try and talk about access to technology and understanding how to use it as a social determinant of health. We've seen kind of in this remote world, the need to have that type of access and have that type of knowledge. So supporting that. And then there's a handful of efforts going on at CDHS and around dementia and around non-emergency medical transportation that I'm very much involved in. So really quickly, I mentioned the Lifelong Colorado and Livable Communities efforts. So I'm not sure how familiar, I know some of you are likely involved in some age-friendly work in your communities, but many of you may not be. And, these are really the 8 domains of livability that are the primary focus of this work. And, from my perspective, it is equity and access to these components across the lifespan that support outcomes in later life. Because aging does not occur in a vacuum. It is kind of the accumulation of experiences across the lifespan, both the good and the bad, that really kind of come together to put us on different trajectories. These 8 domains of livability are directly related to social needs that impact health outcomes. And I would also argue they're directly related to Maslow's hierarchy of needs. So all of this, from my perspective, has a pretty sound kind of a academic and evidence base to kind of stand upon and promote this work at the local level and then support it through state policy. Really quickly, just wrapping up, we are very much at a point in Colorado where we are kind of sorting through what next steps look like for aging policy in the state. I spend a great deal of my time kind of talking and coordinating with other states and kind of seeing what they are doing. To be clear, we are very much a leader in this space. I talked to Massachusetts and California and Michigan and Minnesota a good bit, and they are often looking at what we are doing to kind of try and mirror and learn from our experience as well. So, these are just 4 common components I see across the states, and something that I think we have strong basis and foundations here in Colorado, but it's really kind of working to build these components up so they can be even stronger and more effective. And then this is, I refer to as my pyramid of success. This is kind of at the state level, at the regional level, and at the local level. These are the components that I see that I very much believe that we need. And I think the piece I will explain and focus on, at least just quickly, is the community integrated health network component. Is really actually based on some federal direction from the Administration for Community Living, which oversees the Administration on Aging and our area agencies on aging, and our really was kind of the federal pass through for our Older Americans Act dollars. But they're essentially, long story short, is that we really need to do a better job at the state and local levels of integrating high acuity, well, not even just high acuity, low, medium, high acuity medical care, medical services with the social needs and social services that we could consider non-medical. So in a way, it's kind of blending, at least I try to think of it, if you think about our federal revenue streams, trying to think about how do we blend CMS dollars and how do we blend health and human service dollars at the local level. So they're coming together, supporting community-based organizations and building out those networks so we can increase capacity and meet demand, because we know that right now providers are maxed out. That's not news to anyone. So really kind of building out our capacity to meet our shifting demographics. And then I just end with this, and the intergenerational component is a very important piece to me. Again, being someone in their 30s who spends a lot of their time thinking about this work and involved in it, and I have a lot of great colleagues and mentors who I've been able to learn really wonderful things from that are in their 60s, 70s, 80s, 90s. So it's a really valuable work. And we have to do it all together because we're all a part of the aging population. And that is it. Feel free to email me. You might have to email me twice, and that's okay. Don't hesitate to nudge or poke if you have to. But I appreciate your time, Joe, and thanks.
Yeah, thank you, Jarrett. That's really great information. Well, first I'll open it up to questions for folks.
It's Cindy Cook. I just want to say, Jarrett, we are so grateful to have you in this position. I know you're younger, but you bring so many more different skills to the table in this position. So it's been a pleasure working with you so far. So grateful to have you here.
Thank you, Cindy. I appreciate that.
Jarrett, I had a question. You said it showed that quote showed over half the population is over 60. Do we know what the population over 60 in Colorado is? And what percentage?
It's right now it's about 20%. So that was a global. The quote from Marco Guillen, he's a professor at the University of Pennsylvania, that was the entire world population is over 50%. But right now we are pretty much 1 in 5 folks over age 60. And then 2030 will be closer to 1 in 4.
Jarrett, can you talk a little bit more about the digital equity framework strategy and kind of what wheelhouse that's going into? I know working for Audio Information Network, we're all about providing news and information to people with disabilities, people with any kind of barrier to reading. And so we're very aware of the holes or gaps in the availability of internet and Wi-Fi and those kinds of things to individuals. Can you just talk a little bit more about what that strategy looks like at the state level?
Yeah, happy to, Shirley. And it's a great question. And it's one of those situations where, we were kind of ramping up and trying to do some internal planning about how we wanted to go about this in 2022. But with the kind of progress and movement at the federal level around the Infrastructure Act and the Digital Equity Act, we are kind of in the waiting game at the moment, because I don't think this will come as any surprise, but our kind of order of operations, kind of logical progression for something like this would be, even if we came up with a great policy framework to move something forward in 2022, the budget folks, and rightfully so, aren't going to want to move forward until we have better guidance from the federal government, and we understand what we can do with those federal resources, because the rule of thumb is to draw down on federal resources before we utilize state. And so within the Digital Equity Act at the moment, the version as it currently looks is some block grants for the states to do planning. And then we've already kind of started our planning. So we are a little ahead of the curve on that one. And then while there are those block grants, there are also competitive grants that will be coming down. So what we are really trying to do is kind of strategize and position ourselves to effectively be able to draw down on those competitive grants. And so this digital equity conversation involves, obviously myself and making sure that we're including kind of older Coloradans in this conversation, but also new Americans and immigrants, and as well as closely coordinating with Josh Winkler, who's our disability policy advisor with Lieutenant Governor, to make sure that we kind of really do just have this broad equity lens on kind of how we could be spending these resources. And then to that point, it really comes into who are our community partners, who is that last mile of implementation and development and kind of reaching out to all those folks. So, from my perspective, I think that there's not only an important role for our area agencies on aging, but also our workforce centers, but then also, the many other community organizations and nonprofits and for-profits that lead this work in the state. So, we don't have, very prescriptive framework at the moment, because we got to kind of wait and see what the federal government is looking towards. So one of my immediate next steps is coordinating with CDLE. We're looking to meet with some of the folks at the federal government relatively soon, and just kind of see where they are, kind of what they're kind of gauge their temperature on what they want to see from states, so that we can really position ourselves to be as effective as possible once that money becomes available.
Okay. All right. Thank you very much for that. I appreciate it.
And actually, Shirley, I guess the only other thing I would add is the digital equity work that we're doing is really under the Broadband Advisory Board umbrella. So all of that kind of funnels back up through that to the governor's broadband office.
Thanks, Jarrett. Any other questions? It's really great information. Thank you for that. Really helpful to hear about all the work that's coming through, and the lifelong program and how that's connecting all the dots together. So it'll be great to see how that work moves along. So thank you for sharing that.
Yeah, thanks, Joe. And as I live down at Peoria in Mississippi, so I'm not too far, and hoping to kind of be more engaged with the Rural Health Alliance as I can moving forward, actually. So
Great.
I appreciate the invitation today.
Yeah, well, you're welcome back anytime. And, we'd love to get updates regularly about the Lifelong Project. That'd be great to know how that's coming along. And yeah, happy to hear about that. Thank you. All right. Great. Well, thank you, Cindy and Jarrett, very much. We're going to just open the floor for you folks to give some announcements of resources, events, what's happening in your world, anything you want to bring up related to the work you do. So give it a few moments of silence to open it up to you folks.
I just put up in the chat, we've got some actual in-person, hopefully they stick, reverse mortgage presentations. End of September, and then also in November we'll be in Frederick up at the Carbon Valley Active Adult Center. We have 2 at the Malley Center coming up in October, and would love to have, if anyone's interested, to come and join. Otherwise, I'm trying to walk that line between persistent and annoying. I have a whole box of these books that are on the topic of reverse mortgages. It's not that everyone needs to have one, but I think it's really important that seniors need to understand it as an option. And those of us who work with seniors, I think it's incredibly important to have just a basic grasp of it. So I am bribing people with coffee. If you're willing to sit with me, I'll bring you one of these, chat with you for a little bit. But ideally, this is meant to be used as a resource. There are amazing reverse mortgage professionals in this state. And whether you come to us or you go to one of the others, the idea is to help educate all of you so that you can help your clients make a good decision, whether or not it's something that they want to use. So if you have any questions, I would love to meet up with any of you. And then on the CareTrek side of things, again, it's out of Arapahoe County, but I will be doing the advanced care planning segment for the Aging Mastery Program at the CSU Extension Program in Morgan County again. So I am waiting to get information on how your seniors could potentially sign up for that program. I just don't have that link yet. So if that's something you guys are interested in, again, reach out and I will share that along. Thanks.
Thanks, Amanda. And I did hear Amanda's presentation on reverse mortgages at, I think it was a Council on Aging meeting. It was really, really interesting and really important because I don't think I knew 90% of the things you talked about. So good information to know.
Thanks, Jen.
Yeah.
Well, this is Rich with the Aurora Health Alliance. Guys, my wife and I, we're over 70, we're 74. And we didn't realize that the booster shots for us, for COVID, we thought you had to be immune compromised for the next couple of weeks until this finally released. But what we're finding, what we found out for real practice, is that over at the Anschutz campus, if you're 70 years or older, and it's been 6+ months since your dose number 2, then you get the booster. And Moderna has not been approved by the FDA, but you can get Moderna because that was our last 2. Do any of you know this? And is it more common knowledge than I think? Because it doesn't seem to be common knowledge. I think everyone's waiting 2 or 3 weeks or maybe the end of the month to wait for the government to formally open it to folks. But any thoughts on that?
Well, Rich, I'm glad you brought that up because I just saw a post on Facebook from a friend of mine who has an elderly parent that they kind of take care of, also works in the senior industry, but she's not immune compromised, she's younger, and she got her boost shot.
Mm-hmm.
So I haven't reached out to her yet to say, hey, how did that happen? Because like you,
Exactly.
I thought it was, just if you're compromised. So I'm glad you brought it up because I was wondering that myself.
Anybody well, tongue tied here. Is this a surprise to folks? Marie, did you know about this?
I didn't know about it specifically at Anschutz. I have friends who live with someone who's had an organ transplant. She took him to get a vaccine and they just gave her her booster. I don't think she's even 60 yet. So they're out there, they're available, and I think they're giving them to people that are interested.
Right. Okay. Yeah. If you're for your clients and the folks you work with, they're 70 or older and they last dose of the COVID was 6 months or more, then you can get a shot. You're not hearing it from the pharmacies or from the primary care folks, but it's happening right now on the Anschutz campus.
Yeah, thanks, Rich. Yeah, if you hear something, let us know. Hopefully, I haven't heard much about it, but yeah, thanks for that heads up about it.
Sure.
Yeah, the only thing I've heard is I heard it was 8 months. So the timing is a little different. I too had Moderna, so my husband had Pfizer. So it's like, okay, what mixes with what and when? So yeah, it still seems like there's a lot more information that needs to be solidified as far as the timing, because I don't think I'm ready for it yet, booster wise, as far as the time frame. But I've been notified. He's a veteran, so I was hoping that vets would be notified. And I think Sandy ran off, so I don't know if that would be something that would be in her genre or not, having representing and kind of known about vets. But usually he's called for that, but I think they may be letting them reach out too. So good to know. Thank you for sharing.
I think also if you are registered through one of the portals where you got your original vaccines, they'll start notifying you too.
What I did, and I'm registered with the University Health Systems portal, and they didn't notify me. I said, well, let me just check what's going on. And I said, what? I'm
Yeah.
eligible? It is 6 months too, Carol. It's not 8 months. And the interesting thing is Moderna is not certified yet for the third shot, but they gave me Moderna anyway, because that was my prior two. So they're doing some interesting things there. Joe, I'll send out some information on it from the portal that I was at. If
Yeah.
university can do it, then basically everyone should be able to do it
Sure.
unless they feel there's some ethical issue involved.
Right.
Yeah, thanks, Rich. We have a couple minutes left. Tim, I wanted to let you go. I know you had taken yourself off mute before you had an event going on.
Yeah, I just posted in the event that we're having an in-person Medicare Basics workshop. I do that once a month with to help anybody turning 65. I send out to people turning 65, but it is open to anybody. During COVID, I did it online, and now we're back to doing it in person. IORA Primary Care has opened up their conference room to let us do it in person, since Aurora Public Library still is not having open space. I had a question, Rich. Is the Moderna, is that a booster? Because I hadn't heard that Moderna had a booster.
It's the third shot, which I understand. If you got the third shot, it's a booster. I don't know that it's any different than the second shot, nor is the Pfizer any different than the second shot. But I think for the third shot, FDA has only approved Pfizer, I believe.
Right.
And
Right.
Moderna is coming down the pike pretty soon, but it hasn't been approved yet. That's my understanding.
Thank you.
Thank you.
I-
Marie, did you?
I do. I wanted to tell you all about the Rocky Mountain chapter of the Case Management Society of America. Is having our annual fall conference October 8th. Our conference is heavy on elder care this year. We have Doug Farmer. We have lots of good speakers. We have an elder care panel based on safety in long-term care. October 8th, Denver Marriott West. If you want to register, it's CMSA-RMC, RockyMountainChapter.org.
Awesome. Thanks, Marie. That's great.
Mhm.
Great. All right. And Mandy just put a little info in the chat about doses. All right. Well, thanks, folks. We'll let you get on with your days. Thank you so much for being here. Thanks, Cindy and Jarrett, again for your presentations. And, if you've got things that you'd like to have us put in our newsletter, feel free to send them along, especially if they're Aurora, Arapahoe area, whatnot. Otherwise, thank you so much for being here and thanks for your time. Take care and be well.
Great info. Thank you, everybody. Have a great day. Thank you.